Congestive heart failure, CHF, is a chronic condition in which the heart struggles to pump blood efficiently, often resulting in fluid buildup and edema. Patients with CHF may experience symptoms like shortness of breath, persistent coughing or wheezing, and fatigue, especially during physical exertion or even at rest. Leg cramps, on the other hand, are sudden, involuntary muscle contractions that can cause sharp pain, typically arising during the night or periods of inactivity, and may or may not be related to underlying heart issues. Treating CHF involves a combination of medication, lifestyle changes, and sometimes surgical options, whereas leg cramps may be managed with muscle stretching, proper hydration, and addressing electrolyte imbalances. While risk factors for CHF include high blood pressure, coronary artery disease, and diabetes, leg cramps can be triggered by overuse, dehydration, or mineral deficiencies. Here's a detailed look at the nuanced aspects of both congestive heart failure and leg cramps, including their interconnections and individual challenges. Etiological nature: cardiac dysfunction, muscular overexertion. Congestive heart failure, CHF, and leg cramps may superficially appear as unrelated conditions, but they can intertwine in clinical presentation. CHF, stemming from compromised cardiac function, leads to diminished blood circulation, potentially causing peripheral edema and nocturnal leg cramps due to decreased oxygen delivery to muscles. Conversely, leg cramps typically arise from muscular overexertion, dehydration, or electrolyte imbalances, independent of heart function. However, when experienced by a patient with CHF, leg cramps warrant careful evaluation, as they might signify worsening heart failure or side effects of diuretic medications, making electrolyte monitoring crucial. Differentiating between etiological natures, cardiac dysfunction versus muscular exertion, is vital for directing appropriate treatments and interventions. Common symptoms: fluid retention versus muscle pain. Congestive heart failure, CHF, and leg cramps may present with overlapping symptoms that complicate their differential diagnosis. In CHF, fluid retention is a hallmark, manifesting as peripheral edema, which leads to swelling in the extremities, including the legs. This accumulation can cause discomfort and contribute to an increased risk of cramping. Conversely, leg cramps primarily stem from involuntary muscle contractions that are often acute and painful. While they can occur in isolation, leg cramps might also be secondary to the circulatory insufficiencies associated with CHF. Therefore, in distinguishing between the two conditions, it's critical to consider the broader clinical context, including factors like exercise, hydration, and cardiovascular health. Common symptoms: fluid retention versus muscle pain. When differentiating between congestive heart failure, CHF, and leg cramps, it's critical to focus on clinical presentation. CHF often presents with fluid retention, leading to symptoms like swelling in the legs, shortness of breath, and fatigue due to the heart's reduced capacity to pump blood efficiently. This fluid buildup, while it can cause leg discomfort, is not the acute, painful contracting sensation typical of leg cramps. On the other hand, leg cramps are characterized by sudden, intense muscle pain, usually resulting from overuse, dehydration, or mineral imbalances. Unlike CHF, leg cramps don't have systemic implications, but are localized and episodic. Effective management hinges on accurate diagnosis. CHF requires medical intervention targeting heart function. Leg cramps can often be relieved through hydration, stretching, and addressing electrolyte imbalances. Usual duration, chronic condition versus transient episodes. Congestive heart failure, CF, is a chronic and progressive condition where the heart struggles to pump blood efficiently, often leading to persistent symptoms such as fatigue, shortness of breath, and swelling in the legs, ankles, and feet. This buildup of fluid can contribute to leg cramps, especially at night. In contrast, isolated leg cramps are typically acute, transient episodes. They occur suddenly, causing intense muscle pain and tightness, but usually resolve within minutes to hours. While both CHF-related and independent leg cramps can cause significant discomfort, the chronic nature of CHF requires ongoing management and potential lifestyle changes to manage its systemic effects, as opposed to the more sporadic intervention for random leg cramps. Primary management: medication and lifestyle versus stretching and electrolytes. In managing congestive heart failure, CHF, a holistic approach combining medication and lifestyle adjustments is crucial. Medications such as ACE inhibitors, diuretics, and beta blockers are often prescribed to manage symptoms and slow disease progression. Concurrently, patients are advised to adopt heart-healthy habits such as low-sodium diets, regular exercise with intolerance, and quitting smoking. Contrarily, for leg cramps, the treatment is often more straightforward, with an emphasis on stretching routines and ensuring electrolyte balance. Adequate hydration, supplements like magnesium or potassium, and stretching before sleep can be effective in relieving cramps. While both conditions benefit from lifestyle considerations, the complexity of CHF necessitates a multidimensional therapeutic regimen, in contrast to the more singular approach with leg cramps.